Welcome to our presentation on the role of gold nanoparticles in the detection of ellagic acid in leukemia. This research aims to explore innovative approaches to enhance the treatment of leukemia through the use of nanotechnology. My name is Christian Chapa, leader of the Nanomedicine Research Group, and today I will be guiding you through the key findings and methodologies of our study. Acute lymphoblastic leukemia is a cancer of the blood and bone marrow that affects white blood cells. Despite advances in treatment, the disease remains a significant challenge. There is a growing concern that leukemia remains a major health problem in Mexico, with acute lymphoblastic leukemia, ALL, being the most common cancer in children. Despite advances in treatment, leukemia continues to contribute to a high mortality rate among the pediatric population. Fortunately, nanomedicine has the potential to improve treatment efficacy by optimizing methods of screening and delivery of bioactive compounds, such as ellagic acid. Overall survival has improved in the last decade with the introduction of new targeted therapies and immunotherapy. However, chemotherapy remains the mainstay of treatment, and stem cell transplantation remains the best hope for cure in many patients with adverse cytogenetic risk profiles. Conventional chemotherapy dose intensities have been pushed to the limit and may cause undesirable adverse effects. For example, vincristine-induced peripheral neurotoxicity is a very common side effect of vincristine chemotherapy among pediatric cancer patients. Jasmine Stevens and colleagues in 2022 demonstrated the synergistic antiproliferative activity of polyphenol family compounds with tocopherols. Ellagic acid is a naturally occurring polyphenol found in various fruits and nuts, with demonstrated antioxidant and anticancer properties. It has been shown to induce apoptosis and inhibit cell proliferation in several cancer types, including leukemia. However, delivery of ellagic acid within the complex environment of the human body presents significant challenges. This is where gold nanoparticles come into play, offering a potential solution for enhancing the biodistribution and screening in vitro. Gold nanoparticles have unique optical and electronic properties that make them ideal for various applications in nanomedicine, including drug delivery. Their high surface area and ease of functionalization allow for the attachment of molecules like ellagic acid, which can then be targeted to specific cells, such as leukemia cells. Gold nanoparticles have emerged as versatile carriers of bioactive compounds due to their biocompatibility, stability, and ease of functionalization. By conjugating ellagic acid to gold nanoparticles, targeted delivery of this bioactive compound can be improved. Furthermore, the optical properties of AuNPs can also be exploited for ellagic acid screening in various systems. The primary objective of our research is to develop a gold nanoparticle-based system that can effectively detect ellagic acid in leukemia cells. We aim to assess the sensitivity and specificity of this detection method, compare it with existing techniques, and explore its potential application in clinical diagnostics. Ultimately, our goal is to contribute to the development of more effective tools for leukemia detection and treatment. Our approach involves synthesizing gold nanoparticles and functionalizing them with ellagic acid. Various characterization techniques, including UV-Vis spectroscopy and electron microscopy, are used to analyze the nanoparticles' properties. Our preliminary results indicate that gold nanoparticles formation could potentially represent a detection method for antioxidant molecules in natural extracts. The reaction of gold nanoparticles formation using the pecan nut extract is shown in this slide. It is interesting to note that the coloration of the suspension reaction product suggests sizes around 40 nanometers. These results suggest that our system, based on the formation of nanoparticles, could offer a significant improvement over traditional methods of detection and quantification of total flavonoids and, at the same time, serve as a carrier for their delivery. In this slide, the result of the reaction between the ellagic acid with gold cations on the left and the result of the reduction synthesis with citrate as the reducing agent, which is the widely accepted method for obtaining gold nanoparticles, is in the right. The wine red color observed in the ellagic reduced cations of gold-3 solution is a hallmark of stable, well-dispersed gold nanoparticles. which result from the efficient reduction and stabilization process facilitated by the molecules of this polyphenol. The kinetics of gold nanoparticles formation using ellagic acid were explored through UV-Vis spectroscopy by measuring absorbance at 525 nanometers. Gold nanoparticles formation begins at 5 minutes with a gradual increase in absorbance. By 10 minutes, full formation is achieved, as indicated by the absorbance reaching a plateau with no further increase. From the UV-Vis data, it can be stated that the size ranges in these samples are from 32 to 60 nanometers, which correlates very well with the sizes determined by scanning electron microscopy, as we can see in these micrographs. In conclusion, in this research, we present an innovative approach to detect bioactive compounds such as ellagic acid in various samples by using the formation of gold nanoparticles, AuNP-EAs. The kinetics of AuNP-EAs formation confirm that the method is fast, and the presence of the extract or bioactive compound can be accurately determined. In addition, this nanomedicine system also offers the ability to transport molecules on its surface. Our technique serves a dual purpose, both for analytical detection and for potential therapeutic applications, particularly in AuCl. I would like to highlight the work of Jasmine Stevens, who in 2022 demonstrated that phenolic compounds, such as ellagic acid, have anti-proliferative potential in several cancer cell lines, which we want to take advantage of to design novel nanomedicine systems to advance the treatment of leukemia and other neoplasms. Moving forward, we plan to refine our nanoparticle-based detection system and conduct extensive testing in clinical samples. We will also explore the possibility of integrating this technology into existing diagnostic platforms. Our ultimate aim is to develop a commercial diagnostic tool that can be widely used in the early detection and treatment of leukemia, offering new hope to patients and healthcare providers alike. We would like to thank our collaborators, funding agencies, and institutions that supported this research. Special thanks go to the Nanomedicine Research Group members, whose hard work and dedication made this study possible.